Hello, my name is Alma Edu, and I'll be doing my final presentation comparing healthcare in Luxembourg and to United States. So Luxembourg is a pretty small country within the European Union, and with this small country, they're pretty rich, they're pretty wealthy, and they have a stable economy, pretty good among various countries. So based off of that, their healthcare system is based off their population. So they have a CNS, a Caisse de National Santé, which is basically a national health fund. So what this service is your primary source of insurance. It pays for all healthcare services in Luxembourg. They have a compulsory social insurance scheme following the Bismarck module. What the Bismarck module is employees and employers pays into this fund, and it is used to provide services for the citizens. Because of this, there is a high employment rate because if more people are working, that's more money for the CNS funds. In the United States, because the country is a lot of people, they have a lot of population, so they can't really use a Luxembourg module. Because of that, they have a little bit of the Bismarck module, the beverage module, the national health insurance model, and also people are paying out of pocket because they cannot afford to pay parts of the insurance. So the beverage module, that's solely the government. The government uses taxes to provide health insurance. The national health insurance module has a little bit of the beverage module and the Bismarck module. In Luxembourg, they have a global budgeting, and that is done by the CNS. So no matter what you go to do in the healthcare, in the hospital, for if you have a shoulder disorder, if you go anywhere else, and it's $2, it better be $2 across Luxembourg. So population health. So the life expectancy from birth to death, women live longer than men at 85 years old compared to men at 80 years old. The overall life expectancy is 82 years old. In the United States, women have the life expectancy of 81 years old, but men live at 76 years old. So that's quite a difference. So women all around the world, we are healthier, and we're thriving. So the overall health life expectancy in the United States is 79 years old. So healthcare spending. So Luxembourg, once again, it's a pretty small country, but they're wealthy, and as a result of that, they have enough money, but they don't spend a whole lot compared to the United States in providing healthcare services. So their total healthcare spending per capita is $6,475. That is 6.05% of their gross domestic product. When it comes to the United States, bigger population, they provide various care for different sets of people based on where they are in life, I would say. So their healthcare spending per capita is $10,209, and that is 16.84% of their gross domestic income. So when you talk about amenable mortality, that is basically premature death. That should not happen if people are receiving quality healthcare in an accessible time, in a timely fashion, basically. So in Luxembourg, people who die of amenable mortality in males is 66 per 100,000, and females is 58 per 100,000. In the United States, on the other hand, the potential life lost could be 6 years. Basically, how United States citizens will be able to live 6 years longer if they're able to get quality healthcare services in a timely fashion. So 63% of deaths result from preventable diseases. So like I said, people will be able to live 6 years longer if they have access to quality care, and in a timely fashion. So when we come to tobacco control efforts in both countries, So in America, tobacco accounts for 480,000 deaths per year. Tobacco-related death in Luxembourg for women is 10.47%, and in men is 20.61%. Both countries are doing stuff to help stop these problems. In the United States, they increased tobacco taxes. In Luxembourg, they fine people for smoking. They also prohibited sales for underage minors, and also in the United States, they raised the minimum sale of tobacco places to 21. So where we live plays an important role in our health care. So if you live in a poor neighborhood, you can't go out for a walk. If you live in a poor neighborhood, you probably won't have access to grocery stores. So safe drinking water in Luxembourg plays an important role in how well the life expectancy people are living, I would say. So the water quality is 84.62, and drinking quality and accessibility 75%. So Luxembourg has the safest water in a lot of the countries, I would say. And they filter their water without using any type of chemicals, using ultrafiltration method. In the United States, there's 15% of contaminated tap water, and 80,000 safety violations affected 7 million people in 2015. In 2016, 90% of compliance with EPA standards. So they are working towards bettering their water for their citizens. So access to health care. Rates of uninsured people. So as we see here in the United States, the rates of uninsured has decreased significantly for its citizens. Because of the Affordable Care Act, the rate of uninsured decreased from 44 million in 2013 to less than 28 million in 2016. So the expansion of Medicaid in various states resulted from this decline. In Luxembourg, on the other hand, uninsured people as in 2014 was 2.1%. So like I was saying, a lot of people are working in Luxembourg, so that means more money is going into the CNS funds to use for the people. So there's not a lot of uninsured people in Luxembourg. They have a 99% of insured people as of 2010, so that's pretty good. And social environment unemployment rate in Luxembourg. So the unemployment rate in Luxembourg is 5.3%. The unemployment rate in the United States is 3.7%. Unemployment rate in the youth in Luxembourg is 12.20%. So people in Luxembourg are working, and also people in the United States are working. So that's pretty good to help people, be able to do stuff for themselves in regards to healthcare. So basically the summary, centralized healthcare is much more efficient. Population of a country plays a huge role. If the population is huge, they will have to consider a lot of factors into helping make sure that they service everybody, which is not realistic. Luxembourg provides more affordable healthcare compared to the United States, but they pay higher taxes. Multiple health systems in the United States makes health access to quality care really inefficient. And also all aspects of an individual's lives affect their access to quality health care. So you can't just look at one part, it has to be the whole part. And in conclusion, health is wealth.